Hello, I'm Kimberly Guerrero with Emerge Ortho. I'm joined today by Dr. Nicholas Viens, orthopedic surgeon specializing in the foot and ankle. Today we're going to be talking about foot and ankle surgery and some of the most common questions that he receives from his patients. So, Dr. Viens, tell us a little bit about how you got into foot and ankle surgery.
Yeah, so during residency, I found myself really enjoying all of it, all of my different rotations. But I kept coming back to foot and ankle because it really gave me a chance to sort of treat a wide variety of patients and patient ages. There was foot and ankle surgery we would do for kids and adolescents, as well as doing things like ankle replacements or fusions and in patients who've been dealing with arthritis for years. Ankle trauma was something that we got to do, ankle fractures and heel bone calcaneus fractures, et cetera. So it really kind of let me be a specialist, but do trauma, do sports, do joint replacements, see kids, see older patients. So I really like that. And I also really like that it really wasn't all figured out already. Foot and ankle as a subspecialty relative to some others is a little newer. And with a lot of the technologies that have been coming on and new treatments, I felt like there's really a chance to help figure some of this stuff out and help really make a difference, be innovative. So I really enjoyed that. And then finally, just the community of foot and ankle, just very welcoming and collegial. Not that others weren't, but it was just a great group of people that really had the same kind of interests that I just talked about, and just felt like it fit.
That's awesome. All right, well, let's start with some of these common questions. So, what foot and ankle conditions require surgery?
So we could probably be here for days if we talked about them all specifically, but the big ones,
just some of the common ones.
Yeah, so the big things is often going to be fractures, so trauma, so broken ankle, broken foot, things like that. Now, not every broken bone in the foot and ankle is going to need surgery. It just depends on which bone, how bad, et cetera. But trauma is going to be a big one. And that it can include, recurrent ankle sprains and instability too. You can lump that in with trauma. Arthritis in the foot and ankle can often end up being something that patients have surgery for, whether that's in the ankle as a result of old ankle fracture or in the middle of the foot, rheumatoid arthritis, something that certainly can impact the foot and end up needing arthritis. Bunions or hallux valgus is another name for that. Now, again, not every bunion needs surgery, and that's basically based on pain, really. But that's another one. And then chronic tendonitis that just isn't getting better. Things like chronic Achilles tendonitis or peroneal tendonitis. Those are other big ones that can end up needing surgery of the foot and ankle.
Gotcha. Okay, so if I were to have foot and ankle surgery, how long is my recovery?
Yeah, so it depends on the surgery, of course. Most of the time, surgery tends to be outpatient, meaning you would go home the same day as surgery. Occasionally, for some of the bigger surgeries, you might stay in the hospital all night or at most two, but that's more uncommon that we're able to kind of get people going, get people home relatively quickly. Depending on the type of surgery and the location of the surgery, whether it was up in the ankle or in the toes, will depend on what kind of immobilization you might have, whether you have to be in a splint, which sort of looks like a cast, or you're in sort of a smaller dressing just out in your toes and able to put some weight on it through your heel with crutches. Usually people use crutches from foot and ankle surgery, just at least for balance and confidence. at least a few days on the one end to anywhere from several months, depending on the kind of surgery you had to have. And then usually patients are coming back and seeing us a week or two later and kind of transitioning into either a different type of dressing or into a cast or possibly a smaller dressing from their initial bulky sort of dressing. And then physical therapy, depending on the surgery, that typically can start anywhere from 2 to 6 weeks after surgery. Some big ankle ligament surgeries, can take 3 to 6 months to get over it. It doesn't mean you're miserable that whole time, but it takes a while. It takes a while to get the strength back, the confidence back. Some smaller surgeries, maybe a month or two to feel like you're over it. But even then, you can have some swelling and just sort of stiffness, things like that can last anywhere, to a year for some patients. That can be completely normal after foot and ankle surgery.
Okay, so are there any limitations that there are afterwards besides swelling, like you mentioned?
Again, it depends on the kind of surgery. Swelling is often the big one that I tell patients. You may have some indefinitely. And sometimes that's not so much even from the surgery, but it's more so from the reason that required you to have surgery. So arthritis, the trauma that may have led you to have surgery doesn't just traumatize the bones and the cartilage and the soft tissue, but it impacts the veins and the way the fluid drains out of the foot and the way the muscles help with all that. So swelling is not uncommon. There's certainly ways to help it and things we do to try to prevent it and decrease it over time. But that can be one of the things that patients can experience long term. Stiffness, some of which is intentional sometimes if we're trying to tighten up someone's ankle, for example. But stiffness that patients experience from being in that splint and cast and boot is pretty normal. Soreness on the bottom of the foot as you start learning how to walk more normally again. But typically all that stuff does resolve with time and with stretching and physical therapy and those sorts of activities. But, in the end, the goal is to try to get you back doing everything you did before.
Right.
And hopefully, better because you had an injury or there's a problem that we were trying to take care of to get you back doing the things you want to do.
So that kind of leads me back to my next question. So when can regular activities be resumed?
Right. So it depends on what your regular activities are. So if we're talking about hiking in the mountains and you had a big ankle ligament surgery, it might be 3-4 months or longer sometimes. Sometimes if we're talking about a smaller surgery where you might have had a little bone spur removed or a small cyst or something like that, you might be back doing your normal thing in a week. It all really just depends on the kinds of activities you want to do, the kind of work you do, or what makes you happy. What are we really talking about?
Gotcha. So how should I bathe or shower after my surgery?
Carefully. So it's hard. I mean, there's no doubt about it. I mean, it's tricky. Oftentimes, you have a special dressing on or a splint or a cast, which can't get wet. So there's off the shelf devices you can use to try to prevent getting wet. Even then, they aren't foolproof. They aren't perfect. So you really just got to be careful about not getting that splint or cast wet. And if you do, letting us know, because that can turn into a mess quickly. If you just sort of, it'll be okay. It often isn't okay. So that's the biggest thing. I mean, it's just being careful. But the other issue is that you don't have the normal stability that you're used to. Even if you are allowed to get it wet, you don't want to slip. So sitting in the shower is often a good idea, using a shower chair or a bench, that sort of thing at first, particularly as you're getting more comfortable. Um, and that gets better. I mean, physical therapy often helps, or sometimes it's just not safe at all to be in the shower, or you might be doing a bath and hanging a leg out the side. And but in all seriousness, I mean, it's hard. I mean, there's no perfect way, and a lot of times you just have to be creative. But people do it, and it's hard the first few times, but people always say, I figured it out.
Absolutely. So when can I drive again, depending on if it's my right or my left foot?
Right, and it depends on the kind of surgery you had. So if you break your right ankle, for example, you're not going to be driving for many months. A good rule of thumb is you need to be able to walk around comfortably without a boot, and typically without crutches or a cane. I tell patients, once we get you to that point, then you got to make sure you're feeling confident to do it. So I tell them, go in an empty parking lot with somebody who you trust and who's going to be honest with you and tell you, no, you're not ready. And you practice, and you got to slam on the gas, slam on the brakes, and try to see, because your reaction time isn't normal. You haven't done that in a long time, and you sort of have to pretend like you're 16 again and practice.
Driver's ed all over again.
Yeah. It is, and it can be bad, but I tell people, you need to answer the question for yourself. If a little kid runs out in the street, will I be able to avoid them? And I tell them, I say, if you have to stop and think about your answer, then the answer is no, and you have to wait. And that typically ends up being a good way for patients to gauge it. And, because I can tell them, oh, you're safe to drive. But if they are petrified behind the wheel and feel like they can't maneuver, then they're not safe. So that's the big one. But, if you had a bunion surgery, again, depending on the kind of bunion surgery, it may be 6 to 8 weeks. Even then, you gotta get your confidence back, and again, feel like you can move and you can react to situations. And sometimes people say, oh, well, I'm just driving down the street. I live a mile from my work. Well, most accidents happen within not very far distance of where people live. So you got to be careful, and you don't want to push your luck. Not only do you not want to injure whatever it was that you had surgery on, but you don't want to injure anyone else either. So driving, while it's incredibly inconvenient to not be able to drive after foot and ankle surgery, it can be worse. So that's the big one. But you just have to remember there's light at the end of the tunnel, and you'll get through it. And sometimes you find who your friends are. But you want to plan on it ahead of time, particularly if it's elective surgery. It's one of those things that it's not a surprise that you're not going to be able to drive. So usually you figure it out beforehand. And unfortunately, if you have one of those accidents where you break your leg, clearly that wasn't planned. And it can be even more difficult in those situations to figure out ways to manage, because you didn't have a chance to plan. But even then, patients tend to figure it out. And it is exciting, though, when it's able to tell patients, yeah, I think you're ready, and have them go out in that parking lot and try it. And usually it's soon thereafter they're ready to go.
That's probably a great feeling, to be back to where you want to be.
Yep.
Alrighty, well, thank you so much.
You're welcome.
If your viewers would like to learn more about Dr. Viens, I will be linking his bio in the description below, and you can also use that link to request an appointment with him. So thank you so much for watching, and we will see you next time.
Thanks.